I challenge you to be alone in your pain and find connection. Because when we are constantly trying to find connection, we're actually leaning towards, please help me, please help me, please help me. You want someone to take away the pain. Do you feel alone in your grief? I do sometimes. And this week has actually been a really rough week for me, and I do feel alone. But what is that? What is feeling alone in grief? When I tried to do a quick Google search prior to starting this video, I got everywhere from, oh, it's a normal stage of grief, to it's a sign of depression and you need to seek treatment. And you know, I teach in balance. Both of those things can be true, but the reality is in grief, we often feel alone. And why is that? Why do we feel alone in grief? We want a formula. We like the idea of, oh, there's stages of grief, and this is just a stage that you'll go through and you will come to an end in your grief. And I want you to throw out that mentality of stages of grief. There's two other grief theories that I'll reference today, and then I'll lead you to videos that dive deeper into that. One is attachment theory. So grief is not the same for every person individually, how you respond to grief, nor is it the same based on your attachment to the person that you have lost. And then the other grief theory that I'm going to reference is the dialectical thinking in grief, that both things can be true, that you could be experiencing depression and that this loneliness could be normal. But what is that for you? This is your journey. You are the only one that can really figure it out for you. I am here to be your guide. What do I know about grief? Unfortunately, way too much. So I am a mental health professional. I'm a psychiatric nurse practitioner, over 20 years of clinical experience. But my real experience comes from I have experienced every type of grief. Sudden loss, anticipatory grief. My husband was most recently on hospice. I've even experienced traumatic grief. And it is empowering for me to call it traumatic grief. But this was about 2.5 years ago when I found my daughter had passed away in her sleep. And that morning still is the most traumatic grief that I've ever experienced. And so, you know, these experiences are different. I have lost multiple very close people to me. I've lost 3 children and my husband. And every single one of them was different in how I'm the same person, or maybe the same person. I do think that grief changes you, especially intense grief. But how I process the world is, you know, my personality, yet it was different with each person. And so where does that loneliness come in? It would be practical for me to say, oh, you know, I was a mother of 7 children and now I'm alone, living alone. My other children are grown and gone. I am technically alone. But I can tell you, I felt alone surrounded by people. And I remember when Reggie died and I was surrounded by people who loved me. My daughter, who I lost 5 years later, but she was still my world. Yet I often felt alone in my grief. My husband and I both lost our children. I could be sitting next to him trying to grieve with him, and I felt alone in my grief. Why is that? It is because, let's talk about that dialectical thinking in grief. It's our pain, and nobody can take that away from us. Yet, connection to others is important. What I often see in people, especially if you lean towards being an introvert and you know you have to feel this pain alone, and the pain is so unbearable that you don't make connection with others. Me, on the other hand, I'm like this extreme extrovert and I process externally, and I am begging, not outwardly, but inside, begging for someone to be able to take this pain from me. But I have had to learn that both are true, that you have to be alone in your pain and you have to find connection. And so the original question is, do you feel alone in your grief? And I bet if you're still watching, you do. I bet if you've lost a child, you do. If you've lost your significant other, your partner for life, you feel alone. And oftentimes our friends will say, oh, go to this grief group. Go spend time with other people in grief. And I can tell you, when I lost Reggie, it's been almost 8 years, there was no part of me that wanted to be around other people who had lost a child. And so that is okay too. And back to whether things are normal, you have to do what works for you. And so whether that seems normal or not, you need to figure that out and do that. But you have to figure out what actually works for you. Because oftentimes we're in so much pain, we don't want to feel that pain. So we do everything that we can to stop the pain. How many of you you're drinking too much? You know that you're consuming a substance, maybe even a prescription medication. And I'm not talking about an antidepressant. I'm talking about something that, dulls the pain, likely a controlled substance. How many of you are using that because the pain is too much? And there is absolutely no judgment here. That is, unfortunately, an effective coping. But we have to feel this pain, and you have to do it alone. The actual gut-wrenching pain, your friends could help you initiate it. They could be there as a support for you. I have a friend who I was texting yesterday, and she also lost her son. And we were talking about going to like a smash. They have these smash rooms now where you can just go and break things. And I'm like, I'm in. Let's do it. That is finding connection and doing something for each other. But honestly, as I sat alone yesterday in my house, I just let out a gut-wrenching scream of, it's just pain. I could logically go through, all the things, and I've, reconciled spiritually, and I've worked through so much. But when that pain comes to the surface, I've learned that I've got to let it out. And when it really comes to the surface is when I'm alone and when I feel alone. Last night, I was definitely down and feeling alone. And I have people I can call. My sister lives 20 minutes away, and she is my absolute best friend. I chose not to call her, not because connection is not important, and not because I thought that I would be a burden to her, because I know she would be here, but because I knew that I had to feel it alone. I was talking to my friend who lost her son and encouraging her that it's time to go into his room. And she has not gone into his room yet, and she maybe wanted to go with someone. And I said, that's fine for the first time, or if you need that support. But honestly, it doesn't matter if someone's standing there with you. It's your pain. It's your pain. Nobody can take it away from you. And I talk a lot about what I call controlled grief, but it's this concept that you must feel to heal. And she was saying, I'm scared. I'm scared that I cannot manage whatever comes to the surface. And we talked about what's the worst thing that could happen? You hyperventilate, you pass out. So maybe someone should be close. Sometimes you feel suicidal. That is the ultimate alone. That is when you absolutely need to find connection and professional help. But is that normal? The professionals would say that's not normal. Me, as a mental health professional who has experienced heart-wrenching, unbearable pain, that's what unbearable pain is. We all can get to that point, but it's just a feeling. It doesn't have to be an action. And so oftentimes this aloneness is afraid of being alone. What if I let these feelings out and I die? I have a heart attack or I pass out. That's how much overwhelming pain grief can be. Normal doesn't matter. It is not normal to have lost a child. That's not normal. And I often throw temper tantrums. They're internal and typically not in front of other people. But that was my gut-wrenching scream yesterday as I felt this pain. I am screaming like a toddler who's not getting their way. Like I didn't get my way. So normal is not normal. In intense grief and traumatic grief, there is no normal. If you are experiencing clinical depression, it's significantly impeding your function. You are having horrible internal thoughts, including wanting to hurt yourself in any way. That is professional help. But that doesn't mean it's not normal. My advice to you in this, do you feel alone in your grief? And is that normal? Both is true. I challenge you to be alone in your pain and find connection. Because when we are constantly trying to find connection, we're actually leaning towards, please help me, please help me, please help me. You want someone to take away the pain. And a good counselor, a good mental health professional is just going to be your guide to feeling to heal. So those connections are to keep you grounded, to keep you feeling loved, to know the purpose. But you are alone in that pain. Nobody is feeling your pain the way you're feeling your pain. And yes, I can somewhat understand because I've lost a child, I've lost my husband. I still can't say I 100% understand your pain. I can't take away your pain. I can only guide you on how to work through that pain. Grief is lonely. Grief is painful. And I'm not saying that from a pessimistic point of view. I'm saying it from an optimistic point of view. If you can learn to accept your pain, to feel your pain, the intensity and frequency in which you have to do so will decrease. You can find joy and purpose in what your life now is. Yes, it is different forever. Change is inevitable. And just like me, you might be this toddler that's throwing a fit that this is not what I wanted. I want to go back in time, not let this happen. But here you are. My challenge to you is feel to heal. It's lonely, but have those connections. I really do believe that we can find our mental strength, that you are mentally strong. Keep watching. I've got a whole series on different grief theories and my take on those grief theories having gone through so much loss.